Hello, everybody. This is Dr. Carla here, and excited to bring in Trevor Hausauer for this week or this month's Healthcare of the Future talk, and just a little history about how I met Trevor. We were both sitting in a functional medicine talk from Nutridyne, which is a supplement company that's third-party tested, pharmaceutical grade. Only doctors and pharmacies can sell it, and we both utilize that to this day, which is good. But Trevor and I were sitting next to that, and he started a functional medicine group in the Fargo-Moorhead area and has kind of opened my eyes to many different providers in the area who specialize in things that you might not get in those larger facilities, some very specialized and unique things that we can do with medicine. So I'm going to let Trevor introduce himself, and then today we might spin off a little bit, but we're mostly going to talk about some nutrient IV therapy and how that can be utilized for like sickness or just promoting health. So I'm going to turn it over to Trevor.
Awesome. Thanks so much for having me today, Carla. It's always a pleasure to just come and have some of these conversations and just be able to share a little bit about what we do, some of the knowledge we have, because I think, unfortunately, some of the knowledge that's available and some of the things that are available to improve people's health and or optimize their health is unfortunately is not mainstream. And so if that stuff is not mainstream, it's not being talked about, there's not a whole lot of money behind it. And a lot of times the reason there's not money behind it is because it's not patentable. You know, these are natural products, natural substances that just are not promoted by the conventional medicine system, and primarily driven by the governmental insurance agencies. So I mean, thinking about like Medicare drives almost everything, right? So whatever Medicare does, then the rest of the insurances follow. And so if it's stifled by Medicare, guess what? Then a lot of times we don't see or hear anything about it. So I think it's super sad, but at the same time provides us with a lot of opportunity. So you asked me to introduce myself. So I'm Trevor Hausauer. I'm a family nurse practitioner. I started Valley Vital Medicine about 3 years ago. And so we're here located in the Fargo-Moorhead area. And one of the things that I like to say is we are here to push the boundaries of functional medicine and be able to offer some services that are not available anywhere else in the area, which I think is unfortunate because many of the things that we're using are well established, have decades of use and have shown incredible safety. But my background a little bit. So as a family nurse practitioner, I started out as an RN, and I was in the conventional medicine system and worked in the ER, ICU, got a lot of incredible and great experiences, saw some people at some of their worst points in their life. And, some of those people who were in traumatic experiences, those people needed to be there, right? And we were there to provide those services for those people. But at the same time, there were people who had chronic disease and chronic illness that ended up going to the ER, the ICU, because they had an exacerbation of the chronic problems. And really, if they had the ability and the knowledge to prevent those exacerbations, they never would have been there to begin with. And so that was one of my major struggle points as I was in working as a nurse in these at Essentia. And so as I was kind of wrestling with that, I started to ask myself, well, how can I best help these people get to this point? And so I said, well, I was in the Army Reserve at the time and still had some more education benefits as well. Wanted to make sure that I utilized that and said, well, how can I help these people prevent getting to this point? So I said, well, primary care is a great place to be because you know what, you're outside of the hospital and you're not where those people are when they're already sick. And so transitioned into my nurse practitioner schooling, of course, learned a lot there. It was a great experience. As I was going through my nurse practitioner schooling, one of my clinical instructors, her name is Rhonda Jolliffe. She's out in Bismarck. She's an amazing nurse practitioner out there. we would go through some case studies, and she would say, hey, as a part of these, this case study, yep, I agree with what you said, or I would change this as far as your evaluation, treatment plan, these kinds of things. And then sometimes I would add this, and that this sometimes was maybe, for example, ashwagandha, rhodiola, magnesium, something along these lines. And I'd say, well, where are you pulling that from? Because that was not in the textbook. And, I'd never heard of some of these things before. And so she turned me on to the Institute for Functional Medicine. And so from there, it kind of turned into this Alice in Wonderland, down the rabbit hole type experience, where you start having your eyes open to some of the other opportunities and also mindset shift around the root cause of health problems. And so that really was kind of the birth of my interest in functional medicine. So I graduated in 2015 as a nurse practitioner. I got my initial job in internal medicine at Essentia, working with a ton of people with chronic illness. Some of those people had 12, 15 medications on their medications lists. And, it was a really hard place to work, but at the same time, it was such a valuable experience, because now I completely understand how conventional medicine works, what the mindset is behind that. And so I can totally relate to people when they come in to see us as a client. So I'm super grateful for that experience, but at the same time, it became very frustrating because I couldn't utilize the functional medicine principles optimally in that environment. Now, God gave me the opportunity to move along, start Valley Vital Medicine here about 3 years ago. And so since then, we've been working on trying to provide those services to people that are going to help to provide and optimize their health. So in the meantime, though, I have been certified through the Institute for Functional Medicine. It was quite a lengthy and expensive process, but I'm so glad that I did it. We also have certification through Chris Kresser, his ADAPT training program, and then also AAOT, which is the American Association of Ozone Therapy, certified with them and a part of their membership organization as well. So definitely have spent some time diving into some of these alternative therapies that are out there. Unfortunately, probably many of them should be mainstream, but they've been doing a lot of good for a lot of people, and have really enjoyed seeing the benefits of these therapies for the last 3 years. So hopefully that gives you a good sense of my background on those things.
All right. As Trevor mentioned, he does a lot of things. And today we're going to highlight one of those things, and that I think people get curious about. Some people have heard of like nutrient pushes, or like a vitamin C drip, or there might be some lingo that people have heard about. And one of the reasons I got to thinking about this, Trevor has done this with Dr. Tanya, which we both know, but I've done it with her in the past and Trevor now. But I have used nutrient IV stuff since I lived in Seattle with, we had a naturopath in our office who did them. And whenever I would feel run down, we'd do like even 10 cc, like a nutrient push to help kickstart my immune system so that I could fight viral sicknesses. And lo and behold, it worked. And so I've used different IV therapies in the past for sickness. Now, I don't have chronic illness, so Trevor, you can talk about why you would use them in those instances. But most recently, I was competing for the CrossFit semifinals, and I got a stomach bug, which left me down 8 pounds real quick, really dehydrated. And I guess I saw you 2 days in a row. By the way, if you compete in sports such as CrossFit at that level, or you are in the USA network, just a little asterisk, you need a TUE, which is a therapeutic use exemption in order to do this. Unfortunately, you can't do it to boost your health if you are an elite athlete, because they actually deem that illegal, because it actually works really, really well. So they would see that as an artificial means, but I was sick enough that they allowed it to happen. So just if you're listening and you're that caliber of an athlete, know that you might not be able to do this. You need to read the rules for your sport. So just want to throw that in there. Just never know who's listening. But Trevor, give us a lowdown, because I know there's a lot of different types of IV therapies that you guys offer. So kind of give us your background on like what you offer and why.
Sure. Yeah, absolutely. And we can start with maybe some of the basic drips that we utilize. And so one of the things that most people maybe are familiar with would be something called a Myers cocktail, right? So the definition of a Myers cocktail, I would say, is a little bit uncertain. It's kind of a general overall term regarding a therapy that just has a mix of nutrients in it that can help boost your immune system. So there are kind of a lot of different, shall we say, cocktails or ingredients that people use in a Myers cocktail. So if you go one place to get a Myers cocktail, it may not be the same as what you get from a Myers cocktail from somewhere else. So at Valley Vitamedicine, and actually we primarily are providing IV services right now under the business name of Dakota IV Therapy. So we offer some kind of our main core IVs. Okay, so our main core IV is our first one is called an executive. And so in the executive, it has a nice mix of B vitamins, some calcium, some magnesium. And generally we give that in like a 500 milliliter bag of saline. Now, for people who are looking to optimize their brain function, get a little bit of that energy back, this is a great place for them to start. Now, we do have the ability to upgrade that to kind of that full liter bag of saline. That is a great option for those people. We will actually get people who either walk in or call on a short basis who are maybe indulged a little too much the evening before or over the weekend and are looking for some help with recovery. Also, I think a lot about those people who are athletes, right? And who are, maybe they just went out and they're training really hard for a marathon or an ultra marathon, or they just did compete and they need help with their recovery. So digestive wise, our ability to take nutrients in, I think there's maybe some debate around the percent of the nutrients that you take if you take a supplement orally. Most people, from what I've heard, it's around that 50% area, right? The cool thing about IV therapies, you actually get 100% of those nutrients directly into the bloodstream. And so because of that, those nutrients can get fully absorbed and utilized where they need to be. So we'll move on to what we call our natural defense. So natural defense is kind of that next level up from the executive. So what that does is it actually uses those same initial nutrients, but it adds 15 grams of vitamin C. Vitamin C is a crucial nutrient. We as humans don't actually produce vitamin C on our own. Now, actually, vitamin C is a super interesting nutrient and could be a huge, long conversation on its own. I actually went to Reardon Clinic down in Kansas this last April to learn more about their vitamin C therapies. They've been doing vitamin C for the last 50 years and actually are responsible for the vast majority of the research on vitamin C that we have. So vitamin C, as I said, is crucial. It's super important for it's antiviral, it's antibacterial, it's a crucial antioxidant. And also can help with collagen production. Did you know that you actually have to have vitamin C to produce collagen? So if you're taking collagen, you're taking proteins, you probably should be taking vitamin C along with it to make it work better and optimize that. But most people, when they take vitamin C, they're taking anywhere from 500 to 1,000 milligrams, maybe once a day, but I would have a tendency to say that's probably suboptimal. especially in the environment that we live in today. So we think about vitamin C in animals. Okay, so most animals produce their own vitamin C. We as humans do not. So there's a few other animals that don't, things like guinea pigs, fruit bats, some of the apes. But so take a dog for an example. So if that dog is exposed to stress, what it does is it actually produces more vitamin C in that circumstance. So if they're stressed out, if they're sick, they produce more vitamin C. Now, the question that I thought was really interesting that one of the doctors posed when I was visiting with them when I was at Reardon Clinic, and kind of part of their research, is he said, well, so a question that you asked then is, well, why do they do that? Why do they produce more vitamin C at that time when they're stressed or when they're sick? Well, one of the things that they found or realized is that actually the production of cortisol, right? So we think of cortisol as our stress hormone. One of the main jobs of cortisol actually is to force vitamin C into the cell. So I think about all those people who are walking around us right now, and basically all of us, right, who are stressed all the time because we're exposed to toxins. We have stressful careers, stressful jobs. We are exposed to viruses and bugs and all these things all the time, right? And they're walking around with incredibly high cortisol levels all the time. Well, why is their cortisol not resolving? Is it potentially because they're vitamin C deficient and that cortisol is not able to do its job? I think that there's a very real likely possibility. Now, granted, I want to make sure that I'm clear on this. I don't have necessarily scientific evidence of this, but this is something that makes a lot of sense to me, that I think that theoretically this could be a very strong thing that, or a very strong idea that if we had more people taking vitamin C, we may have less cortisol and stress hormone problems. So that's kind of an interesting thing about vitamin C. And so vitamin C also is quite a flexible nutrient in that in low levels of replacement, it's actually a really strong antioxidant. However, once you get to 25 grams and above in a dose of in an IV therapy, it actually becomes an oxidant therapy. Okay. So an oxidant therapy can play a very crucial role in helping with health as well. And so obviously you're huge into exercise. Well, what do we do with exercise? We strain the body in a beneficial way to make it stronger. And oxidant therapy does the same thing in regards to our immune system and our cellular structures in our body. And so if we give 25, 50 grams of vitamin C in a dose, that actually stresses your immune system in a positive manner to help it to respond in a beneficial way. Now, most of the people that we utilize higher doses, 50, 75, 100 grams of vitamin C at a time, are more of the chronic disease and illness type people. I think a lot about cancer patients. We do a lot of high dose vitamin C for those people and see incredible benefits with that as well. But so vitamin C is one of those really crucial, really fun nutrients. One more that I'll kind of wrap up with a little bit is we take that same mix of nutrients, so the B vitamins, calcium, magnesium, vitamin C, and we can add a couple grams of glutathione to that. So glutathione is a substance that your body produces naturally. It's considered your body's master antioxidant and is really a great substance to help with skin purity and clarity. It also helps a lot with detoxification. Okay, so it's really great for kidney health, liver health, and for people who are just under that stress all the time, trying to optimize some of that hormone production as well. So those are kind of the main nutrients that we're utilizing. Now we do have other things that we offer as well, but so things like ozone IV therapy and NAD and some of those other things, but we can maybe have a little bit more conversation about that on another day if you like. But what questions do you have, or how can I further elaborate on things for you?
Well, I think a question that I know people will ask is, we talk about all these vitamins and nutrients, and you elaborated to like, oh, maybe we absorb 50% of it. And I think there should be a little like asterisk on that as well. Like, that's if your digestive system works well.
Yep.
And so I think there's a number of people who understand they have some sort of, maybe it's not a full-fledged, dilemma or disease, but they've got digestive issues. And a lot of people just will say that. And so if you're one of those people, you're probably not getting 50%. And so obviously, I think Trevor and I are both on the standpoint of like, we need to eat like real whole food, like from plants and animals and like vegetable sources. And we need to make sure that we get that, because that's obviously very important. But knowing when the time and place is to like seek further care. And so like, who would you recommend? We can even talk chronic disease, but maybe people in generally good health, because those are people that are generally going to be watching and listening to this from our end anyway. From chronic disease to people with generally good health, when would be a good indicator to seek out some IV therapy?
For people who chronic disease people, the answer to that probably is yesterday for most of those people. These are therapies that really can make a huge difference in how people feel. So what I'll just real quick talk about what I talk to people about when they come in. So there's really three main responses that people may see when they come in and they do some IV therapy. One, people may feel that they're actually a little bit more tired, right? So that's not actually a bad thing. What that tells me is like your body is working through all those toxins. It's working to heal and utilize the nutrients that we just gave it. Okay. There are people who don't notice a whole lot. Now, some of those people I think are maybe not very insightful into their own health and how they really feel. And so I encourage those people maybe to do a little bit of self-search and self-insight, maybe do a little bit more meditation so they're more in touch with who they are, right? The other and frankly what we see the most is those people who they're normally tired, they have a hard time getting out of bed, they're not getting the things done they want to in a day. But all of a sudden now, guess what? They are waking up and they feel better. They also notice like, man, I cleaned my house this weekend and I haven't done that in 6 months, right? So those are some of the things that we see. Now, for chronic illness, and in particular, you think about those digestive issues that you talked about, things like ulcerative colitis, Crohn's, people who have had gastric bypass, right? So we know these people are not digesting, utilizing nutrients as they should. And so these IV therapies can do a lot for improving their health, improving their energy, improving their nutrient balance, to help give them kind of that little push and kind of get them over that hump a little bit so they can function better. One other thing that I'll mention here is that we will get patients who come in and it's just kind of a one-time deal, right? They overindulge for the weekend and, hey, you know what? I need to be able to function today, so I just need some IV fluids today. Okay, fine. You know what? We can do that too. But at the same time, for people who are trying to improve their health with chronic disease or optimize their performance, a one-time nutrient, it can be helpful. It's not a bad thing, but it's really not going to give us any of that long-term benefit that we're really hoping for. And so generally what we see is that people will see a better longer-term improvement in their health if they're consistent with it. It's the same with exercise. It's the same with eating healthy consistently, right? If you do it once, okay, great. Are you going to see the long-term benefit of it? Well, no, probably not. And so oftentimes what I'll tell people, hey, you know what, if you want to really feel the benefit of this over the long term, you're probably going to want to do like one a week for like 4 weeks, then consider doing like every other week for 4 weeks, so that we can kind of get your nutrient levels plussed up a little bit. It's kind of like, 2 steps forward, 1 step back every time you do this. And eventually those steps add up, and now you have more of those nutrient stores in your body. So if, I would say any of us who are alive, we utilize these nutrients all the time. Our body's trying to learn how to function every day in the midst of all of the stressors that we give it. And so, it does take some work to optimize how we feel. And so I think too, especially, we have athletes who come in regularly for some of these nutrients because they do see the benefits in their performance, right? Are they doing this because, hey, you know what, I'm training for a marathon, or I'm training for a triathlon, or whatever it is that they're doing, and they notice their recovery is better? They can optimize better, faster, longer. I would postulate they're less likely to have injuries because they're going to be better hydrated. They're going to have a better nutrient status. Their collagen levels are going to be higher because they're getting some of that vitamin C that they need to have more optimal source of that as well.
Yeah. I think we get the question on recovery a lot. Some of the things we like to help people dial in on, and I think you're totally on board, but like, hey, are you sleeping at night? That's pretty clutch. What kind of food are you eating? Are you eating enough of it without overindulging, and enough of the right kind of stuff? Are you hydrating? Like, those are your pretty basics. And, a lot of people have gaps in those, but, after that, if you're not managing stress or some other things and you can't recover, I think this is it's a great option, right? Like, you want people to be all around healthy, but sometimes we need this leg up to bring that level up in order for when we sleep at night for our bodies to actually replenish. And if it's not happening, sometimes getting the extra nutrients in can definitely play a factor. We do have a question that popped up from Lisa. It's, do the results from blood tests in conventional medicine accurately reflect the amounts of nutrients in our bodies, sodium or magnesium, for example?
Source of major debate, right? So there's a lot of different ways of testing some of those nutrients. There's plasma levels of magnesium. Say some people test red blood cell levels of magnesium. Some people say that the levels of magnesium should be significantly higher than what the conventional lab range is. And then you have other additional lab tests that you can do. And so, I would say in general, that's a really hard thing to get adequate nutritional feedback from some conventional labs. Now, some things like B12 and folate and vitamin D, some of that, I think you can do okay, but even that can get really complicated, and you maybe sometimes need to look at some other things like homocysteine, for example, or methylmalonic acid to really get a sense of whether those nutrients are actually being utilized in the body the way they're supposed to. You can do some additional functional medicine evaluations, some things like a Nutri-Eval, something along those lines that can give us a lot deeper insight, or maybe even an organic acids test. That can give us, that shows us more of the metabolites to see like, hey, do you have the byproducts from the utilization of those specific nutrients that show that your body has an optimal use? So I would say that most conventionally used lab tests are probably insufficient or suboptimal in trying to evaluate nutrient status.
And I think of the general lab test when people come in, they'll screenshot their chart or whatever, so I can at least take a look at it. And I don't necessarily do extensive lab work like you do. I just generally try to look at it. But, in the range of normal, right, from a conventional standpoint, it's like, it's such a broad range, but like, it kind of tells you on those, like, you're not super, super sick, but
Right.
it doesn't necessarily tell you like, am I well or how do I get well? And
Yep.
I think that's like the missing gap. It's not that they're not useful, it's that there's some missing links in there. And take for like, for instance, vitamin D. Like if I'm within the range of normal, but I'm like on the lower end, well, that can mean a whole lot. Even though it didn't get flagged as low, I could still be taking like 10,000 IUDs a day in the winter, and that's what I need, right? So I think they're helpful, but like you said, there's a lot of other factors I think that could be taken into place. Like, and I would encourage people too, if they get them back. And I just had somebody the other day and they're like, well, the doctor said everything's fine. And I'm like,
Yeah.
well, how do you, they're like, just like, I don't feel good. Like, I don't feel
Right.
fine. And I think that's the main, thing too, is people know what it's like to hopefully feel well. Some people don't yet, but sometimes people know like, this doesn't feel good. Like, I don't feel great right now,
Mm-hmm.
but encourage people to follow that instinct too.
Yeah, 100%. And I think it's super interesting to like the way that they get normal lab ranges. Do we realize that those lab ranges fluctuate and change from year to year? And they're based on population averages, right? So is our population getting healthier or sicker over time? It's getting sicker, right? And so our normal lab range actually gets to be include more and more sick people in what we consider normal. So just vitamin D, like you mentioned, I see significant vitamin D deficiency all the time. But one significant statistic to keep in mind that I think is really interesting is that people who had top range optimal vitamin D levels instead of normal, top range optimal vitamin D levels were 95% less likely to end up in the ICU with COVID. That's huge. Just on that one statistic alone. Like, so you take in similar to what you do, I'm sure, Carla, like I utilize a functional medicine or like an optimal lab range, right? So I have conventional and then I look at optimal. And so even taking things into account like testosterone or hormones, right? So the normal testosterone is like what, 250 to 1100. Like, how is it that big of a range? That doesn't make any sense whatsoever. Most guys don't feel good unless it's at least 700, if not 900 to 1100. That's where like optimal really should be.
Right.
Yeah.
Yeah. Not well is different than sick, right? Like,
Yep. Yep. So yeah, I mean, and a question I like to pose all the time is, are you healthy or are you just not sick? And without some data behind that, we don't know.
well, that's awesome. I mean, and I just wanted to thank you for coming on. And this is sort of like my goal for these healthcare of the future talks is to really get people to start thinking outside the box of like, what can the healthcare of the future actually look like, which is what we're trying to do here. So if we can stop a lot of sickness and illness before it actually occurs, then hopefully we don't need as much of the ICU like you used to work in, right? So I appreciate you taking your time and expertise to come on and chat with us today. And we might have to schedule something for this winter on some of the other things that you do, because I think they're important for people to learn about and hear about, because like you said, it's not always mainstream, and we just need to get the word out there that there are other options if you just take a moment to look or use your resources.
Yeah, 100%. Love being able to provide some resources and some therapies here that aren't otherwise widely available. The things that I love about what we do and I love about what you do, right, is the fact that people come back feeling better all the time. They can take their health to a whole new level. They don't realize how bad they felt until they feel good, right? And you see that all the time. I see that all the time. Love having people come back all the time and just feeling better. And we're just blessed. God's blessing us. We're blessed to be able to do what we do, to be able to just hopefully add a little bit of hope to people's lives, because unfortunately there's not nearly enough of that in this world and in our conventional medical system. So if we can offer some hope, some additional options and availability for people to optimize their health, that's what we're here for.
Awesome. Well, if you want to learn or hear more from Trevor, you can check him out at valleyvitalmedicine.com. I know there's a lot of good stuff on your website too. And if you forget that, just reach out to EHP Performance and we'll get you his info. Thank you so much for joining us today, Trevor, and have a great week.
Thanks for having me. Have a blessed day, and thanks so much for your time too.